Hi, my name is Dr. Walt Haddigan. I'm a member of the Medical Information Team and Director of Clinical Content at Epocrates. I lead a group of editors who are responsible for creating content found in the Epocrates newsfeed, guidelines, and our labs feature. For those times when you're faced with an abnormal lab test result and the reason behind it isn't immediately clear, the Epocrates lab reference, which is part of the Epocrates Plus subscription, comes in very handy. Imagine you've ordered a serum ferritin in a 40-year-old male patient who's vegan and has been complaining of fatigue and weakness. The serum ferritin result is 17, which the lab report indicates is below the normal range. So let's delve into ferritin a little more. Going to the Epocrates Labs section, we'll type in ferritin, and then clicking on that lab test will reveal the lab information for ferritin. At the top is a brief description of the test. A little further down is a reference range, in which case here we see for an adult male, 20 to 250 is normal. And under lab result, because our patient has a low ferritin, we're going to tap on low to reveal a list of potential causes and contributing factors, including conditions and drugs. Now, tapping on iron deficiency anemia, for example, we can see some more information here where less than 10 nanograms per milliliter is considered diagnostic. So our patient isn't quite there yet. But we do find that recommended follow-up labs, if we're considering iron deficiency anemia, include a serum iron, a total iron binding capacity, and a CBC if not already ordered. Now, for completeness, let's look at other potential causes. Tapping into protein deficiency, we see a list of possible underlying causes of protein deficiency, as well as recommended follow-up labs if protein deficiency is suspected, in this case, albumin and prealbumin. And note, whenever a disease or a drug cause is listed, and Epocrates has a separate topic for it, it's always just a click away. So for example, tapping on iron deficiency here will take us to the iron deficiency anemia disease topic. And just like for most other content in the Epocrates app, tapping on the bookmark icon at the top right of the screen will save this lab for quicker access later.